So PLAB2, you will have 3 domains, and I usually mention this: the data gathering domain, the management domain, and the IBS domain. Okay, and each one of these 3 domains contain sub domain. Okay, like if we are talking about the data gathering one, first of all, for the newcomers, my name is Ibrahim. I'm Ibrahim Salah. I'm Egyptian doctor. I'm PLAB2 coach. I'm doing PLAB2 tutoring, and I'm doing mocks and guidance like this. Okay. And we will continue doing the sessions every Sunday. I will try my best to stick to this time. So PLAB2 exam contains 3 domains. The first one is data gathering domain, and the second one is IBS, and the third one is management domain. And each one of these 3 domains contains subdomain. Like if we are talking about the data gathering one, it contains the history taking domain, and examination and investigation. And if we are talking about the management domain, it contains subdomains. Like in most station, especially in medicine, in counseling station, you have to give provisional diagnosis. And after that, you might need to do further investigation to confirm this provisional diagnosis. And you might need to do management, which might include admission of the patient or referral to a specialist or another clinic. And you might need to give lifestyle modification, which is non-medical. And you might need to do follow-up or safety netting or just closing the station. So again, the management domain, you need to do provisional diagnosis, to give provisional diagnosis. And because you are FY2, so at many stations, you will be suspecting the diagnosis, okay? And because you are in an exam setting, so you might suspect the diagnosis because you didn't do enough investigation to know the exact diagnosis of this scenario or of this patient, okay? So no problem at all to say, I'm suspecting this is blah, blah, blah. This is glaucoma. This is subconjunctival hemorrhage. No problem at all. Be safe in the exam, okay? And you need to mention something about management. Sometimes you will do the management by yourself, or as I mentioned, you will refer the patient to a specialist or another clinic to get the management. And at some point, you may need to do safety netting. But please, one of the avoidable mistakes in many stations that people start to invent safety netting for every station. You don't need to do safety netting in all stations. There is a specific scenarios you need to do safety netting, especially if there is a red flag or you are suspecting there is a problem that might occur to this patient. Like if you diagnose this patient with a benign condition and you are afraid that a serious condition might occur, so you need to do safety netting to the patient, okay? But please don't invent new safety netting because it will be irrelevant, okay? You will not be safe and you will not collect more marks by inventing, by saying safety netting or mentioning safety netting in every station. Some station you need to do follow-up of the patient. Some station you need to just reassure. Some station you need to just say, thank you for coming today. Thank you for opening up to me. I'm here to address your concern. This is the ending, okay? So this is the second domain. The third one is like a general domain, which is IBS domain. And this domain include many aspects, like your body language, your facial expression, the way you gain information from the patient, the way you deliver the bad news to the patient, like you are natural, gentle, and nice doctor. And let me tell you, this is one of the most easy and difficult at the same time. You need to know what should you do and to apply this to your approach. Okay, we will do sessions about IBS. maybe in the coming days. Okay, so let's start talking about the ophthalmology. Ophthalmology is one of the important branches in this exam, and it is an easy one. You just need to know the approach, and this is my note. I will give you the general approach for how to tackle any ophthalmology, any eye scenario, and after that I will comment on each individual scenario alone. Okay, everyone is hearing my voice clearly. I don't need anyone to come at the end and say I can't hear you or something like this. So my sound is clear till now. So ophthalmology, we have many scenarios here, but we will have just general approach to any eye station. First of all, the patient will come to you with some symptom like he might come with pain in the eye. He might come with like problem in vision, itchiness, like with trauma, like with redness in the eye. So we have many symptoms, and each symptom corresponds to certain condition. We will discuss it in detail in a moment. So first of all, you have to introduce yourself to the patient. Hello, I'm Dr. XYZ. I'm one of the doctors here in the clinic. Can you please confirm your name and your age? I would prefer to say it in this way because you will save time. Okay. Again, hello, I'm Dr. Ibrahim, one of the general doctors here in the clinic. Can you please confirm your name and your age in one shot? Because if you started, can you please confirm your name, and after that, can you please confirm your age, you will consume more time. Okay. And after that, try to collect IBS marks from the start. Like if you notice that the patient is on pain, reflect on him from the start. I can see that you are holding your face. I can see that you are holding your eye. I can see that your eye is red. I can see that you are in pain. Okay. Can you tell me what is the problem? So you will build a rapport with the patient from the start, and you will gain more marks on the IBS from the start because you are a good observer and you are a caring doctor. All this point matters in this exam. Okay. So after that, he will give you one symptom. So start by open question. I prefer in any station that you can ask open question, because according to the time, if you started to ask a detailed question, for example, if I'm telling you I have a pain on my eye, if you started to ask a detailed question like since when, is it continuous, is it started, is it gradual or sudden, all this question, you will consume about 3 to 4 minutes just to analyze the pain without asking about differential and past medical history if needed or other relevant question. So I would prefer to ask open question, tell me more. And let me reassure you, in the exam, you might find 1 or 2 patients who might say, like what doctor? But most of them will give you the detail about this symptom. Okay, because you will hear from many people, they usually ask you, like what doctor? What do you want to know? Yes, there will be a patient like this in your exam, but 1 or 2 out of like 16 or out of, according to the number of stations, out of 15, sometimes they cancel some station. Okay, so after asking open question, start asking a detailed question. There is a specific approach. This is a very simple approach, and it will cover everything. First of all, which eye? What about the other one? And if we are talking about ear, also you can ask this question: which ear? What about the other one? And after that, start the analysis. First of all, ask about function of the eye, which is vision. So we have 3 questions. Are you able to see? And after that, are you able to see distant object? And after that, are you able to read? Okay, he will give you an answer for this again. So first of all, are you able to see? After that, are you able to see distant object? And after that, are you able to read? Because every answer, if he said yes or no, it will make a difference. It will lead you to a specific condition. And after that, do you see things blurry vision, double vision, straight lines appear hazy, sensitivity to light? This is a general approach, and we will specify everything in a moment. Okay, again, do you see things blurry? And the blurry vision is associated with many conditions, like it could be glaucoma, it could be problems of optic nerve, it could be cataract. We have many conditions the patient come and complain of. It could be GCA, come and complain with about blurry vision. Okay, so blurry vision, double vision, could be optic nerve. A straight line appear hazy or wavy, it could be cataract or age-related macular degeneration, and sensitivity to light. Okay, so after that we have inflammation question. Like if this patient have inflammation in his eye, the question might be, do you have any pain in the eye? And let me tell you that if the patient have pain, it will be the primary or the presenting complaint of the patient. Again, if the main complaint of the patient is pain, he will come telling you, I have pain on my eye. Even if there is a problem with vision, he will tell you, I have pain, and after analysis, you will find that there is associated problem with vision. Itchiness, discharge, bleeding, okay? So I name this symptom inflammation question, okay? After that, you need to ask him about any contact, and contact in the eye could be trauma. He sustained some trauma to the eye, especially if he presented to you complaining of pain or complaining of redness in the eye. Redness could be inflammation of the eye and could be hemorrhage in the eye, okay? Again, so contact here means that the patient sustained trauma to the eye, or the patient wearing glasses and stop for a while at this point. Ask him if he changed the glasses recently, or if he do frequent changes of the glass, because this might lead you to a condition like we're talking about, the problem in the lens, this cataract or age-related macular degeneration. Or if the patient is wearing contact lens, again, so the contact question, did you sustain any trauma to your eye? Especially if he is coming with pain in the eye or redness in the eye or bleeding. If he is wearing glasses, and comment on glasses, if he is wearing contact lenses, okay? There is a specific question related to different scenarios, like if we are talking about glaucoma, do you see any colored halos around light? And complete the question. Don't tell me, do you see any colored halos? No. If I'm looking to this light, I will see colored halos around the light itself. If I'm looking to the sun, I will see colored halos, very big colored halos around the light. So colored halos around the light. Or if the patient is having retinal detachment, so he might say black curtain. And please complete the question, because many people say it in the exam like this. Do you see any black curtain? Yes. He will try to be funny. He will tell you, yeah, I can see black curtain in front here at the window. No black curtain coming down and blocking your vision. Okay, so complete the question. Night blindness and color blindness. Night blindness for retinitis pigmentosa, but it is rare nowadays in the exam. Okay, and color blindness, it could be because of optic nerve. Okay, so this is the general approach. You can apply this approach to all the station, but if you found specific finding from the start, it will lead you to the other question. Okay, one of the most common scenarios in ophthalmology is glaucoma. Okay, and simple explanation for glaucoma occur because of increased pressure in the eye. Be simple. When you start to explain glaucoma to the patient, just a minute, I will put the charger. To explain glaucoma to the patient, let me tell you, the patient doesn't need to know this sophisticated medical jargons and medical abbreviation. He's not a medical student. He just need to understand the condition in a very simple way. Okay, so don't waste your time, because I can see many people during my box who just have 2 minutes during to tell me the management in the one-to-one mock, and they consume like 1.5 minutes just only to explain to me about the definition of glaucoma. It is irrelevant at all. You have only 1 mark to mention the name and 1 mark to mention to explain it. Okay, so just think about this in the marks way. I need to collect marks. Don't consume 1.5 minutes from the original 2 minutes explaining about glaucoma to the patient. I'm sorry to comment on this point, but this is a very common mistake and it is avoidable. So you can avoid this mistake in your exam. Okay, so explain it in a very simple way. You have increased, you have a condition in which the pressure in your eye is increased. It is called glaucoma. And I'm suspecting it could be because of one of the risk factor, which is the patient might mention about it. The patient might mention many risk factor, okay? And the patient might mention some triggers, okay? So one of the most common risk factor for this glaucoma in the exam will be medication. The patient is using some medication and he will tell you about this medication, and he might tell you, I was watching TV in a dark room, or I was in a cinema, okay? So this is the trigger for the condition. Again, so he have risk factor, and he might mention about this risk factor, and he might mention about the trigger. The risk factor here, or the common risk factor, is medication. He is using some medication. I brought to you here all the medication you might find in your exam, because they change this medication from time to time. Okay, the people is used to certain type of medication like amitriptyline. Okay, so when they bring another medication, they stuck in this situation. Okay, so all this medication can be a risk factor for glaucoma and other medical condition too. And the trigger could be the dark room. So at this point, when the patient mentioned to you, I was watching TV, what were you doing when you have this pain or you have this redness? I was watching TV. So ask him this question. The room was dim. Okay, the light was dim, or the room was dark, because it will make a difference. Because you will advise him again until referral to the specialist not to watch TV in a dark room. Okay, so the symptom of glaucoma starts sudden, and the primary symptom here could be severe pain within one eye and an ache around your eye. So it could be severe pain, and the presenting complaint of the patient could be severe pain. And after that, he will mention something about redness, and after that, blurred vision or reduced vision again. So the primary complaint of the patient would be sudden severe pain. So it will be sudden. Usually glaucoma pain come all of a sudden, okay? And you might see redness in his eye, and the vision will become blurry, and the specific thing, which is circle or halos around light, okay? There could be other symptom. Pain may spread around the head. The eyeball itself might be very tender, like a rock. You might feel sick, okay, and you need to ask the patient about feeling sick, and do other differential, like if the patient have this pain only in one eye, you might ask the question of GCA, because the patient comes with Blurry Vision too, about headache, cluster headache. So ask 1 or 2 differential to differentiate the condition. Okay, we have 2 types of glaucoma: open angle glaucoma and close angle glaucoma. And ideally, for the purpose of the exam, I don't prefer to dig further or to dig more into this point, because if you diagnose if you diagnose the condition as glaucoma, this is enough. And after that, we will know which one. You can guess which type of glaucoma during the exam, no problem. But don't waste your time explaining it is closed angle glaucoma and it is because of closure of this 1, 2, 3. It is an emergency condition, so you need to act very quickly to treat the patient. Okay, so we have two type, open and closed angle glaucoma. So again, starting from the diagnosis, before diagnosis, you asked the general approach and you asked the question of glaucoma. Just examine the patient, examine him, examine the eye, but don't shine a light on the eye. Be attentive, because it could be a closed angle glaucoma, it could be open angle glaucoma. You don't know. You might increase the severity of the condition. So it is advisable to mention it in this way. I need to have a look at your eye. Okay, I need to have a look at your eye. Okay, and if there is any finding, he will give you the finding. And after that, you need to mention the condition to the patient in a very simple way. And the best approach to mention any condition is to explain it, and after that, tell him the medical jargon. Again, like if I'm talking about glaucoma, you have mentioned to me that you are using this medication or you have this risk factor, and you were watching TV on a dark room. So I'm suspecting you have a condition in which the pressure in your eye is increased, okay, which is called glaucoma. Actually, you came at the right time right now. We need to admit you in the hospital. Okay, we need to start the treatment immediately. And start your treatment with the painkiller, because the patient will be in pain. Okay, painkiller, and again, painkiller, and Dr. Mustafa, just write down the question and I will answer all your question, people, at the end of the MOOC. Okay, write down the question and I will answer all your question at the end of the MOOC. So the painkiller, anti-sickness medication, and some medication to decrease the pressure inside the eye. Again, painkiller, anti-sickness medication, and some medication to decrease the pressure inside the eye, which is eye drop containing beta blocker, biocarbon eye drop. You may give him IV acetazolamide to decrease the pressure. If the medication didn't give its effect, you can give him medication to decrease the pressure also, like mannitol. Okay, and after stabilization, you will refer him to specialist. Okay, so this medication or this treatment is the emergency treatment. And after that, after you stabilize the patient, you will refer him to a specialist who will do the further treatment for this patient, which might be a surgery. He will assess him again, and he might do a surgery which include laser treatment or surgical treatment. You don't need to know the detail, but at least just remember the name, like laser or surgical treatment to decrease the pressure, because the patient might ask you, what will the specialist do for me? Again, so the treatment, you need to mention the name. I would prefer to mention the name, but if you stuck in this situation in any station, just mention the action of the name. Like, I can't remember Timolol eye drop, biocarbon eye drop, IV acetazolamide. I would say it. I will give you a medication. I will give you a medication to decrease the pressure inside the eye. I will give you a medication to decrease the pressure inside the eye. Dr. Mustafa, because I answered this question, how will shining the light worsen glaucoma? Isn't it the opposite? I didn't say that. Sometimes we don't know the type of glaucoma. Is it closed angle or open angle glaucoma? So I would prefer to say, I will have a look. I will examine your eye without examining the back of the eye, or without mentioning about the back of the eye, because the patient will be very irritable. Okay, so again, people, if you stuck in any situation in the exam, like One of the common situations is the test of carpal tunnel, which is funnel test, tunnel test. The names are very difficult. Just say 2 specific tests, which include and explain the test. I will give you 2 specific drugs to decrease the pressure inside the eye. As a patient, and I'm a patient in emergency condition, I don't care about the name, but I care about this drug. Okay, if there is any side effect of the medication, you might need to mention, especially if it is like a serious side effect in this patient, you might need to mention about this side effect if you have a time. Okay, so and after that, refer the patient to the specialist who will do the further treatment, which include laser or surgical treatment. Okay, this is glaucoma, which is one of the most common scenarios in the exam and the most common emergency in ophthalmology. After that, we have subconjunctival hemorrhage. And the patient of subconjunctival hemorrhage, despite it is very easy and very benign condition, but the patient will came to you in the clinic in a very scary condition. He will be scared because the appearance of the eye and this patch of redness, yeah, it looks very scary. Okay, just before starting your data gathering, reassure the patient. Before starting asking a question, just reassure him that it might be a very simple condition and you are in the right place right now. So we will assist you and we will help you. Okay, don't forget to do so. So subconjunctival hemorrhage, from the name, it is one cause of red eye. And the patient will come to you telling you that I have a red eye. Please be attentive to this conflict. The patient will tell you from the start, I have a red eye. My eye is very red. So you might not think about subconjunctival hemorrhage. You might think about glaucoma, subconjunctival hemorrhage, conjunctivitis. Many scenarios can present with red eye. When you mention about examination, he will give you a photo or image or illustration which include this subconjunctival patch on the eye. Again, so you will not know from the start if it's subconjunctival hemorrhage or not. So make sure that you will ask, you will cover all the question. What causes this subconjunctival hemorrhage? There is many causes, but according to the exam situation, it could be episodes of coughing, bouts of coughing, or vomiting, excessive vomiting. So don't forget to ask about this symptom. So add this 2 specific symptom to the general approach of ophthalmology. Okay, like did you had any episodes of coughing recently? Did you have any flu-like symptom? Did you experience any excessive vomiting recently? Okay, and if the patient is a newborn baby, it is very, very common during a pregnancy. Just reassure the mother, or rarely it could be associated with high blood pressure. So ask in the past medical history about high blood pressure, or it could be because of bleeding disorder like hemophilia, or the patient is using anticoagulant like warfarin. And if he mentioned about bleeding disorder, or if he mentioned about using of blood thinner, ask other question, like if the patient experienced before unusual headache, okay? And if the patient told you about bleeding disorder or using of blood thinner, ask about bleeding from anywhere else in the body, or patches of bruises in his bluish discoloration of in his body, okay? So according to the finding, complete your history. Okay, so what will be the treatment for subconjunctival hemorrhage? Just reassurance, no need for treatment. You might give him only eye drops to decrease the irritation, like a lubricant for the eye, to decrease the irritation of the eye. Just reassure him that this usually fade and disappear within 2 weeks. And don't forget to safety net the patient. Don't forget to ask him about trauma, because trauma could be one of the causes. Did you sustain any trauma to your eye? Okay. And if he had this patches in a recurrent condition, he had it before, okay? And if he noticed any unusual bleeding or bruising on his body, you need to safety net him about this, especially if he had bleeding disorder or if he are using a blood thinner. Don't forget, you might lose one mark if you didn't safety net the patient. So safety netting in such a situation is important, people. Why? Because this condition is very simple condition, but it could be a presenting complaint for serious one, which is a side effect of blood thinner, which can lead to hemorrhage on the brain. Again, you need to safety net the patient in such situation. It is very important, and you will have some marks for it. Okay, diabetic retinopathy. We have two scenarios in the exam about diabetes, which is this scenario, diabetic retinopathy, or patient coming for review. Okay, we have another scenario, which is the patient was learning this difficulty, who came to you to explain to him about insulin pen. Again, scenarios, the common scenarios in the exam about diabetes. The first one is diabetic review, and the second one is diabetic retinopathy, and the third one is this the patient with learning disability, learning difficulty, who came to you to learn him how to use the insulin pen. Okay, so beside the general approach of ophthalmology, you need to add question about diabetes, like if it is a diabetic review, because he might come to you on GB. Okay, he might come to you on GB. So diabetic retinopathy occur because of many causes, and it is very easy, and you can explain it to the patient, like small blood vessels swell, like some leak from the leak of fluid from the blood vessel, like bleeding from small blood vessel on the eye. So many causes for this. And the main treatment for diabetic retinopathy, is to control diabetes or high blood pressure. Again, the main treatment, control diabetes and high blood pressure. And after that, you will refer him to do laser treatment. Okay, and you might need to explain to him about this laser treatment. Just explain in a very simple way what will the specialist do for him. You will refer him and tell him in a simple way that laser treatment is used to treat this diabetic retinopathy. Okay, but it is rare, it didn't came since long time. Cataract. We have two conditions that will come on old age person, usually, which is cataract and age-related macular degeneration. And these two scenarios are a little bit confusing. But let me reassure you that usually age-related macular degeneration come in older patients, like 70 or 60 and over that. Okay. So cataract can occur in newborn, but it won't come in PLAB 2 exam. It can occur in young people, but it will not come in PLAB 2 exam. Usually, it will come in old age. Cataract are cloudy, opaque areas that develop in the lens of the eye. Could be the complete lens become very cloudy. The lens should normally be clear. However, with cataract, the affected lens become like frosted glass. Okay, what is the cause for cataract? The cataract begins with changes to the structure of the protein in the lens. You don't need to mention this to the patient. This is for your knowledge. Some of the protein clump together in places within the lens. This causes tiny areas of cloudiness. Each tiny area of the cloudiness block a bit of light getting through to the retina. So you can see in normal lens, this is the shape of the light after crossing the lens. But in clouded lens, there is scattering of the light. You don't need to mention all this to the patient. But what is the causes for cataracts? Cataract can occur without apparent cause. It could occur because of aging, but there could be poor diet. So be sure that you ask the patient about his diet. It could be because of smoking, diabetes, steroid, especially if he is young. Okay, don't forget to ask about steroid, and please be specific. In this scenario, if you asked about, like you need to ask about family history for some condition, mention this condition. If you need to ask about specific medication, mention this specific medication. Like, did you use the steroid in the past? Have you been using steroid? So ask him. Having a family history of cataract is a risk factor too. There is other risk factor, maybe statin medication, maybe previous surgery, maybe severe short sightedness. So ask him about if he is using glasses and if he is changing glasses frequently or if he changed the glass recently. Okay, so past medical history is important in cataract and in age-related macular degeneration too. Past medical history. Past, please be attentive to this. Past medical history is very important when you have a condition like this. What is the symptom? The patient may tell you, I can see some spots on my vision. Or rarely, he can tell you, I can see some halos around the bright light. Okay? Or straight lights seen less well in, or he might tell you that he see less in brightly lit rooms or in sunshine. Again, he will see less in the bright room, which is the reverse of age-related macular degeneration. Washing out or fading of colors. Okay, over the year, your vision might or may gradually become worse. So from time to time, the vision will decrease. The visual impairment is not corrected by glasses. And I mean by that, he have problem in vision. So he went to the optician to change the glass. After changing the glass, the vision problem corrected, but a little bit, because the cataract can't be corrected by glasses only. You need to do a surgery. Okay, so how the specialist or general doctor or the optician diagnose cataract? Just by examination of the eye. It is very clear to diagnose the cataract. What is the treatment for the cataract? The treatment will be surgery. So he will have a surgery to remove the cloudy lens and to put another one. We'll have a surgery to remove the cloudy lens and to put another one. Be attentive to this. He will have a surgery to remove the old lens and put a plastic or new one. And this will be a day case surgery. He will come to the hospital and he will do the surgery at the same day. And this surgery will be under local anesthesia, like anesthetic eye drop to numb the eye. Okay? So again, day case surgery, remove the old lens and put a new one. And it will be under local anesthesia. All these are questions. The patient might ask you this question. Can you tell me? And he will ask you detailed question. He will ask you detailed question. What is the meaning of day case surgery? Some patient in the exam before asked this. What is the meaning of the day case surgery? Okay. And after that, he might ask you, any one of the doctor can answer this question. Can I do both eyes if I have cataract in both eyes? Can I do the surgery for both eyes at the same day? Can anyone answer this question? Can I do the surgery for both eyes at the same day? Okay, no. May I know why? Can anyone answer me? May I know why? It's very simple. First of all, to minimize the infection, and also for the patient to be dependent. Imagine that you will put 2 patches for the patient. He will be blind. Okay? He will be blind. So it is logic to do one by one. Okay? So this is a very easy scenario to tackle in the exam, and you must get high mark in such type of scenario. Okay. We have another condition, which is macular degeneration. Macular degeneration. The macula, there is degeneration in the macula. We have 2 types of this, which is dry type like this, you can see, and they can give you a photo. So try to familiarize your eye with such type of photos. All the image for ophthalmology can brute in the exam. So try to see them again and again and again. So this is dry macular degeneration, and this is wet macular degeneration. Dry and wet. Dry and wet. What is macular degeneration? It is degeneration of the macula, and the most common risk factor. Again, people, what is the most common risk factor for macular degeneration? Can anyone answer this question? What is the most common risk factor for macular degeneration? Age. So age. So it is named age-related macular degeneration. The most, it is age-defining illness. Okay. So age is the most common cause for macular degeneration. So most commonly in the exam setting, you'll have a patient like he's 70, 75, 80, 85. This is usually the age. Okay. We have two types of macular degeneration, and you need to know which type, because according to that will be the treatment. One of them is non-treatable, and the other one have a treatment. Who develop age-related macular degeneration? Older. So age is the most common risk factor. Older people, or people with severe sight problem, or there is a family history for this condition. Okay, you might have this in the result of examination. As a result, tiny abnormal deposits called drusen develop under the retina. In people with age-related macular degeneration, the cells of RBE stop working. So with advancing age, they gradually fail to take enough nutrient to the roots and the cones, and don't clear waste material. This waste material accumulate on the under the retina, causing this drusen to develop under the retina. You might have this finding in the result of examination. When you mention about examination to the patient, he will give you this paper, and in this paper, this will be written. Sometimes the retinal pigment cell and their nearby roots and cones degenerate. So one of the common risk factor is age, and it usually occurs because of age. You know, when people become older, they forgot to eat well. They doesn't have enough nutrient. They usually doesn't wash their eyes like as before. So this waste material start to accumulate in the eye, and also the nutrients needed for cones and roots, the patient are deficient in it. So he will start to develop this macular degeneration. But don't forget to ask about smoking, okay? Why? Usually in the approach, I name some question in the history primary question. What is the primary question? In my approach, I name it primary. Primary question is the question you need to ask, because you will use this question to explain to the patient about the diagnosis, or even you need to know this information to reach to the diagnosis, or you may use this question in the management. Like sometimes smoking is a risk factor for some condition. So you shouldn't forget about smoking. You need to ask, because you will tell the patient in the management, stop smoking, quit smoking, okay? It's very, very important to ask this primary information. If there is any medication responsible for this condition, don't forget, you will lose some marks if you didn't ask about this question. But sometimes there could be secondaries, like allergy, like if the patient is doing exercise or not. You don't need to ask all this question or other irrelevant question related to the condition. According to your time, be focused according to the time you have. Sunlight and poor diet also is a risk factor. Macular degeneration, the treatment for macular degeneration, you need to give him some lifestyle modification, like stop smoking, like protecting the eyes from sun rays by wearing sunglasses. This is lifestyle modification. Like occupational therapists can reassess the home. You might send some person to assess the home situations, the lighting of the home, especially in a condition like this. You might give this patient advice about using magnifying glasses, enough light to read, because the complaint might be, I can't read in my home. I was able to read in the bus, but now I can't read. So you might give her advice about it. Treatment for dry macular degeneration, there is no specific treatment, okay? But for wet, you will give anti-vascular endothelial growth factor injection. You will refer her, and she will be assessed, the patient. She will be assessed by a specialist. If it is dry, you just need to tell her and change the tone of your voice. In some patient, it is like a breaking bad news. In some patient, and I don't mean, or most people understand that breaking bad news should come as separate condition. The patient is dying or the patient is having cancer. Sometimes you might need to change the way you are telling the news because it is severe news. And this is what means bad news, okay? So when you tell the patient, where you are about to tell the patient about dry, it could be dry, which you don't have any treatment for dry type. We will try to decrease the progression, but it will progress. We'll try to decrease the progression by give her enough diet. You might refer her to a dietitian. She might be prescribed like multivitamins, nutrients. This will decrease the progression, but it will not prevent it. But for the wet type, she will be referred, and she might give anti-vascular endothelial growth factor. Okay, there is the National Health or the National Institute for Health and Care responsible for assessing the patient eligible for this treatment. You don't need to mention about this. The practical help here, people. The practical help here is that magnifying lens, enough light like this. If the patient might need the certificate of visual impairment, he might be provided with this, because he might have a benefit from the social service. And please be attentive to things like this. It will increase your IBS score. Okay, if the patient have macular degeneration in both eyes, he might be eligible for certificate of visual impairment, which might put him or made him entitled for certain benefits from the BNF. And also stay safe with regards to driving. If you are registered as having sight impairment, you shouldn't drive, and you should notify the driver and the vehicle licensing agency, the DVLA. Okay, he should mention this to DVLA. Okay, after that we have retinal detachment, which is the detachment of the retina. Will be like this. This is the pathology, the floaters, the photophasia, flashes of light in the vision, and this is could be the visual field. Okay, so retinal detachment. Can anyone tell me the causes for this detachment? The causes for retinal detachment? What could be the causes? Trauma. So beside the general approach, ask him about trauma. Okay, the patient is myopic. There could be past medical history of hypertension, but the first question: did you sustain any trauma to your eye? What would be the presenting complaint of the patient? What would be the presenting complaint? Which specific question you might ask to the patient? So the patient have flashing light, the floaters. The patient might tell you that he have vision loss. No, it is rarely came in the exam. There is retinal detachment. It came before, but nowadays it didn't come since long time. Okay, but you know they might bring, or in each exam they brought a station from the old scenarios. So prepare yourself for something like this. He might say that he had sudden loss of vision. It is a very emergent condition. You need to act very quickly, because according to your management, the patient may have a treatment for this condition, or might not lose his vision. Okay. Treatment for retinal detachment, like he need to stick this retina again. So you will do referral. The only treatment here is referral to a specialist, immediate referral to a specialist, or if he is in emergency, you ask a specialist to come and review him. And the treatment of retinal breaks with laser or by freezing, scleral buckling. You don't need to mention the name, but just mention that he will do intervention by a specialist. Okay. This is the most common ophthalmology scenario. Hope I explained the scenarios in a very clear way. And 2 minutes, and we will start a mock. I will choose from the people who had exam very soon. We have 3 scenarios. I will be the role player, and you will be the doctor. Till now, everything is clear. People, till now, everything is clear. Did you go to today's topic? Yeah, I choose to do it in this way. In order to make you know about the scenarios itself, and also we will do a mock. Okay, and the coming session will be like this. We did sexual transmitted infection before in this way, and most people told me this is the best way we can do it. Thank you, Dr. Khaled. So I have 3 scenarios. I have three scenarios. Usually, the cataract will tell you I can't read in very bright light. But the macular degeneration, he will tell you, I need more light to read. Okay, I need more light to read. And the age also, usually age-related macular degeneration will tell you, sorry, he will be older. Okay, we have three scenarios. I need to choose from people who had exam zones. Okay, people who had exam zone. Okay, who need to do the station. So before I forgot about this. People, we will start the course again. I think some of you attended the previous course. To do a high yield course, it is 10 days course. We cover all the topic like this way and with more details. With more details, it will start the next week. We only take 10 people, 10 to 15 people in order to be able to do mocks with all of them. Like we explain the condition at the same way, and after that, we do a second session for the mock itself. It will be 14 days, and we will cover all the high yield topics. Like I will explain the approach, and we will apply this approach on the high yield topics for the exam, the new scenarios and the high yield topics. Okay. Also, the mocks for August is now open, and don't worry, I promised you that I will continue the free sessions. Okay, don't hesitate to contact me anytime. I respond to everyone. It's not about money at all. Okay, I'm here to help you. I know that a lot of people talk about the exam, and there is a lot of a very bad reputation about this exam. So I'm here to correct this point as much as I can. So don't hesitate, again, don't hesitate to contact me anytime to ask about anything. Okay. I will explain the optic neuritis, double vision. I will explain the optic neuritis in neurology. Okay, wait for it. Yeah, let me give you the groups before I forgot, because every time I forgot to give you the groups. Don't worry, we will start the mock in a minute. Yeah, Telegram group, I think this is the best one, because I have many WhatsApp groups. Sometimes I forgot to add the point on the topics on Telegram. Okay, it is £100 for the course, and 80 for a group of 5. 80 for a group of 5. The maximum number for the whole group is 15 people. A second, I will share with you the Telegram. People, this is the groups. And this is the my website, with many of you asking me about it too. This is the link for the procedure book and the procedure course. Okay, and you will find the discount link on the group. This is for newcomer. I know that many of you know about it. Okay, so let's continue.